audience, for Macular Awareness Week this year, I would like to talk on a very oft-discussed topic in our clinics, central serous retinopathy, CSR or CSCR. Now, why is the macula so important that we have an entire week dedicated to the macula? At the back of our eye, we have a light-sensitive nerve fiber layer, rich layer called the retina that helps us to see. And the central part of the retina is called the macula. So naturally, anything that is going to affect the macula like CSR is going to affect the central part of your vision. Now in the OPD, the persons afflicted with CSR, the active working middle-aged man in the 20 to 50-year age group is always a worried person, and we take time to explain the disease process and pacify the patient. One fine day, they are actively engaged in their work, often racing to meet a deadline when they notice a dark central shade in their central vision all of a sudden. Wherever they look, they see a black circle. Objects appear to be smaller and further away than they really are. Lines appear to be bent, distorted. Everything appears to be dull. And all these makes reading, driving, using computers, carpentry, operations difficult, and they walk into the OPD a concerned lot. We look at the retina, and once we see that characteristic blister-like fluid collection at the macula, and it is diagnosed to be CSR by OCT imaging, we just offer 2 words of advice. Don't worry. Now, though the exact cause of CSR is still unknown, what we do know are the 2 most important risk factors for CSR: stress and steroids. Yes, CSR occurs in those stressed out, fastidious type A personalities, sleep deprived individuals, mostly either due to insomnia or sleep apnea, and people on steroids, either oral steroids as for autoimmune or arthritic conditions, inhalational steroids as for asthma, or even steroids in the form of skin ointments as for skin allergies, are prone to develop CSR. Now in females, pregnancy is a linked risk factor. Gastritis due to Helicobacter pylori infection, use of smoking, alcohol have all been linked to CSR. So once you're diagnosed with CSR, try to avoid these risk factors. Females, if you're pregnant, relax. Once the pregnancy is over, CSR is going to subside. If you are on steroids, consult with your primary care physician and see if the steroids can be withdrawn or substituted. And relax. Have your meals on time. Practice yoga, meditate, exercise, ensure you sleep at least 7 to 8 hours daily. Let go of your worries, and we are going to do nothing but follow you up, because 90% of CSR resolves on its own in 3 to 4 months, leaving back a very good visual prognosis. But even after your CSR is resolved, don't go back to the hectic routine, because you still are at risk for development of a second episode of CSR, either in the same eye or in the other eye. Okay, and if you have a recurrent CSR, if your CSR has still not resolved after 5 to 6 months of wait, or you are a person who can't afford to wait for 3 months to let the vision clear on its own, then we go ahead and do a fundus fluorescent angiogram. A fluorescent dye is injected into the arm, and in rapid succession, fundus photos are taken. We identify the exact spot of leak and go ahead and laser the leak, or do PDT, a photodynamic therapy, to seal the leak and ensure faster resorption of the fluid. So that is all about CSR. Wishing you healthy eyes, and wishing that may your eyes live long to see good sights. Thank you.